Hi, this is Dr. David Klein with Stages of Life Medical Institute in Longwood, Florida. Thank you for joining us. We're going to discuss right now COVID-19 testing. Who needs it? Where do you get it? What does it cost? And then what do you do with the data? And this is sort of an important question because everybody wants to go get tested because it costs them nothing. The federal government offers free testing. All of a sudden, everybody wants to get it. This was a huge mistake. If they'd put a $20 copayment on it, this would have made more sense. Okay, why? Because then the folks that really don't have all that much concern are going to walk the other way. COVID-19, interesting virus. Corona virus has been around a long time. We've known about this for 50 years or more. It is not anything new. It's a veterinary virus that crossed species in China. This is the way these things go. A lot of viruses will do this, and then it takes off, and then we have to deal with it. Because PCR testing, this is something that we do at Stages of Life, which is DNA and RNA testing, has allowed to identify the pathogen, they picked it up as a quote-unquote novel virus. There's nothing new about it. It's just one that hadn't been picked up before. It's like going to the rainforest and finding a new type of hummingbird. Congratulations, they found a new virus. So who needs it? Who needs to be tested are individuals that you're going to make a therapeutic decision. So if somebody comes in and they're breathing so badly that they look like they're in distress, that person clearly needs to be tested, which is kind of why most of the testing right now is being done in the hospital setting. Does this person need to be admitted? Are they at risk of respiratory failure? You test those folks. You've got to. If you're in the military, and much of the testing apparatus is now being diverted to the military, it will shut us down. If one sailor on a ship gets sick with COVID, that ship is now isolated. It takes a very expensive and very important platform offline. So again, it's important there, but it's not so important here. So the individuals lining up at the do-it-yourself stations more than likely don't need it. So who gets tested? First thing, your temperature has to be elevated. If you don't have a fever, you're probably not carrying COVID. You're probably not sick. If you're not coughing, you're not short of breath, and you don't look sick, you probably don't need to be tested. Younger individuals are really less likely to throw a fever, and older people are less likely to throw a fever. So the demands, the testing threshold has actually decreased. So if you're running around 99 and change, 100 and change, you might need to be tested. So don't line up and take Tylenol, because if your temperature drops, they are going to throw you out. And well, they should. They need to verify that you are somebody that needs to be tested. So what does it get you? So if you're positive for COVID, they're going to tell you to stay home. Well, wouldn't you know it, they're doing that anyway. Okay, so you've changed nothing. If you happen to test negative, does it give you very much? The answer is no, because it doesn't mean that in 20 minutes you're not going to be exposed. So understand that the testing has limitations and it can be very, very disruptive. My default setting is not to test because you're not going to get information that is actionable. There are things you can do should you think you have COVID. There are things you can do to prevent yourself from getting COVID, and we can discuss that. Where do you get tested? Your doctor's office may or may not have the test kits, which are little more than brushes that you shove in somebody's nose and stick into a tube. This is really not high science here. This is not rocket science, as they say out in Titusville. This is easy. But, okay, the test is not run in the doctor's office. It's actually run at a reference lab. I own a reference lab. We do COVID-19 testing. It's done on a DNA machine. These machines don't come cheaply, yet they are only available in certain areas. So it's going to be sent out, but there's a huge backlog on it. What does this mean? It means that you're put at the end of the line. The folks that are able to get the test done quickly or quicker are inpatients at the hospital setting. We have a machine that does 1,000 tests an hour. Okay, that's a lot. But most of the machinery that's out there, they'll do 4 to 6 tests in 45 minutes. So, well, we can test it in 45 minutes. Yeah, but there are 500 people ahead of you. So you do the arithmetic and figure out when your test is going to get done. So now what? Okay, so you wait around for that test to come back. You've got nothing for it. So please don't go out there and get tested willy-nilly. If you are sick and you think that you're getting sicker, you need to go to the emergency room. You need to line up because you're the person that's going to need to be tested, not mom that has a couple kids and one of the kids has a runny nose. This is not going to happen. It's not going to help anybody. Again, for prevention, lactoferrin-containing colostrum. You take 2 of them at bedtime, just baseline. And should you get ill, you take 2 of them 4 times a day with a licorice root capsule twice a day. That will give you just what you need to get by. We have been treating lots and lots of patients with this, and we've had really great success with it. It's cheap, it's easy. If you want to look at the products, it's at stagesoflifevitamins.com. You can buy from us or not. It's okay. Read what the products are about. That's spelled COLOSTRUM. Okay? Find the product. We have audio tapes on there for you to listen to. Look at it. But the dosage is 2 at bedtime, followed by 2 4 times a day should you get ill. That's how we're doing it here. That's how I recommend you do it there. Thank you. This is Dr. David Klein, Stages of Life Medical Institute, Longwood, Florida.